Confused about whether you're battling a cold or an allergy? I know I am. So here are some ways to tell the difference.
Hi, I'm Dr. Linda Dahl, and I'm an ear, nose, and throat doctor. So how can you tell the difference between allergies or a cold? Well, the biggest difference is with a cold, you feel achy and sick, you may have discolored mucus, and the symptoms tend to last for about 3 to 10 days. If your symptoms are lasting longer and less severe, and you may have clear mucus and just itchy eyes, watery eyes, runny nose, sneezing, then that's more likely to be allergies. And so what can we do about it? There are a lot of decongestants and antihistamines, but a lot of people find that the medications come with a lot of side effects that they'd rather not experience, or that are sometimes worse than the cold itself or the symptoms themselves. So I usually recommend sinus allergy rinses, and Waterpik makes a wonderful sinus rinse that makes it a lot easier for patients to use, and it rinses out the sinuses to clear the mucus and clear any of the irritants that could be causing the inflammation, to really allow the sinuses to do what they do naturally.
For more information, visit waterpik.com.
Go ahead.
All righty, we're asking the question here.
All right, thanks, John. Well, coughing, sneezing, hacking, we know the symptoms, but we're not always sure the cause.
Yeah, it could be a cold, a sinus infection, or perhaps even worse. And the bad news is the spring allergy season is now upon us.
Joining us with more on how to identify what's ailing us are immunology physician Dr. Linda Dahl and Mike Trengel from the Asthma and Allergy Foundation of America. Hey, guys.
Hi, how are you?
Morning.
Doing well. Eager to learn a little bit more about this. It's always tough to tell, especially this time of year when it starts, at least here in Michigan, starts getting a little bit warmer. What are some of the easy ways we can tell if we're suffering from allergies versus just your common cold?
Well, the biggest difference is that when you're sick or you have a cold, you actually feel sick. You're achy, you have a fever, the mucus may be discolored, and it usually lasts for about 3 to 10 days and then goes away. And with allergies, the symptoms can be usually less severe, but they're more prolonged. So you'll have watery eyes, runny nose, sneezing, and mucus will be clear, and it can last for months.
Well, with the spring upon us, what can we do to help alleviate some of those symptoms that those springtime allergies bring?
Well, there are a lot of different options. For my patients who have more severe symptoms, I usually recommend prescribed medications. For most people, if your symptoms are mild or if you know when they occur, just certain seasons of the year, then there are a lot of options in the drugstore, a lot of decongestants and over-the-counter medications. But more and more, I recommend more natural treatments for my patients. And my favorite treatment is sinus rinses. And Waterpik makes a great version of the sinus rinse, and I usually recommend that for my patients.
Now, as far as people who suffer from asthma, that sort of thing, a little bit more serious, chronic bronchitis, what do you recommend that they do? Because I feel like this time of year, it's almost 10 times worse for those people than for just the common allergy sufferers.
Well, for patients who have really severe symptoms, it's important that they see their physician. And if you try medications over the counter for a day or two, they're not working, or your symptoms are really getting bad, then you really need to see your doctor.
Now, you know, in the springtime, a lot of the allergies that are different from what are in the fall. So what are some of the things that people are allergic to that, you know, for example, I'm allergic to mold, and I know that's one of the things that shows up in the spring.
Well, you know, it's interesting. Allergens are present all year long, but you're right. Springtime, it's really tree pollen. Mother Nature lets go of that pollen in the springtime from our oak, birch, and other kinds of trees. Very important that you work with your doctor. They can uniquely do a diagnosis through blood tests or skin tests to determine exactly what you're allergic to. And that's the first step on your path to really good health and treatment. From that, they can determine what best to help you prevent or treat your symptoms. We actually put some free information up on the website waterpik.com, where you can go and download all this information that Dr. Dahl is talking about, how to distinguish between cold and flu and allergy, but also links out to information about flu shots, information about other allergies, and it's really a great way to start your spring.
And actually be able to enjoy the springtime rather than have to stay inside.
Sneeze through it.
All right, guys, thank you so much for joining us. We appreciate it.
Thanks.
Well, more coming up in the 8 o'clock.